Hi, this is Jennifer Lessie. We're going to be administering subcutaneous fluids to a cat today. I have all of my supplies over here. So we have our lactated ringers, sterile solution right here, sterile bag. I've got my plunger to draw up. We are going to be using a 60 cc syringe. Our doctor orders, we are going to be giving lactated ringer solution, or LRS, subcutaneously. We're going to administer 50 mils. Rule of thumb is about 10 mils per kg per injection site, and our animal weighs 10.7 pounds. So I'm going to go ahead and do that calculation for you. So we have 10.7 divided by 2.2, and then we're going to multiply that by our 10, and so it's 48.6. So we're going to go ahead and give that 50 mLs. As I said, I've got our 60 ml syringe. I have an 18 gauge needle to draw up the fluids with, and we are going to be inserting with a 21 gauge butterfly catheter just to provide more comfort for our patient. We do also have our alcohol and cotton swabs to clean our injection site. So I'm going to go ahead and get our setup while Morty is just hanging tight in his enclosure. So I'm going to set the record and calculator over there, just so I have room on my tray to set everything up with. All right. Okay, so I've got the bag. I'm going to leave the cap on the bag. Open up that syringe, uncap that needle, okay. Insert, and then I am going to drop the full 60, because what I'm then going to do is flush that butterfly catheter, because I want to make sure that I'm not just administering a whole bunch of air. So once I place that butterfly catheter, I'll go ahead and flush it and prime that line. So I am going to pull out 60 cc's in my syringe. And I'm going to pull back a little farther. I've got an air bubble in there, and I want to get rid of. There we go. Pull back again. All right, so you can see I drew up the 60 cc's. Now I'm going to go ahead and take out my needle. I am going to do one cap handing to recap my needle. So that's there. I'm going to leave this on until I'm ready to open up my catheter. Now there is a little rubber stopper on that needle to keep it clean and sterile right here. So I've got that. I'm going to unwrap. Now I'm going to go ahead and flush that line. All right, and we are to the 50, so we are going to be administering all of that, the solution to our animal. All right, so we're going to go ahead and have our assistant get our animal out. Okay. gonna go ahead and use my alcohol. I'm gonna insert that needle right in here. I'm gonna make a tent. Got some nice loose tissue behind, in between the shoulder blades. So I'm gonna place my alcohol there. Use my gauze to clean that. So we're nice and clean. Good job, buddy. All right. Set this down, release that cap. I'm gonna do bevel side up. I have a nice tent. I'm gonna go into that subcutaneous tissue, bevel side up, insert at a 90-degree angle. It's in. I'm gonna go ahead and have my assistant hold that. I'm gonna aspirate, checking the hub. I don't have any blood in there, so I'm gonna go ahead and start to administer slowly. As I administer, I am feeling around for the tautness, making sure that the fluid is flushing through nicely. So we do have a nice little fluid bump there, and it's not too tight. And we're giving it a nice steady rate. And again, just check in that the needle is still in. I have some good fluid on that outside, is flushing around, so nice loose tissue. And then once we've administered all the fluids, I'm going to go ahead and kink that fluid line as I remove the needle.
Oh boy.
Good job, Maureen. And then I'm going to massage that site, that injection site, to assist in that blood clotting and just kind of massage those fluids around. Okay. All right, so we've given the full 50 cc's. I'm going to go ahead and kink that line and then pull it out. Whoop, my assistant's got that, and then I can hold and apply pressure and, of course, massaging out that fluid. So we have successfully administered subcutaneous fluids to our patient.